This conference will now be recorded.
During your OSCE, if you get a station on fetal medicine, all you need to do on this station is given here. Here is how to approach this station. You will enter the cubicle. You should introduce yourself. You can say something like this: I am Dr. So-and-so, and I'm covering the clinic today. And I'm here, or you can also say that I'm here for the exam. Then you need to confirm the identity of patient. You can say that, are you Mrs. So and like let's say you can say, are you Mrs. X? She will say yes. So I understand that you are this many years old, and then you should confirm the purpose of consultation. You can say something like this, that I understand that you are here because the baby is a bit large, or you can say that you are here for consultation as the baby has some water in the tummy. Is that correct? She will say yes. So you have set the agenda now. You have the purpose of consultation. Now you should start with the history. So ask her that, can I ask you some questions? They are important for your management. So check the period of gestation. So you can say something like this, that can you please tell me how far you are into this pregnancy? Then you need to ask her, is it your first pregnancy or you had pregnancies before? How were your previous pregnancies? Then ask about this index pregnancy. Say, how has this pregnancy been so far? Any screening was done in the start? What about the liquor? What about the water around the baby? Did they tell you something? Are you having any medical condition? Are you taking any drugs for any condition? Okay. Do you know about the gender of baby? She will say yes or no. Then you should ask her. If she doesn't know, then ask her, will you like to know about the gender of baby? If she says yes, then you should disclose. Otherwise, you should not say anything. Then you need to explain the findings. Like if you have done a scan, then you can say that your scan was done. Can you please tell me why it was done? If she says something, then you should give appropriate response. If she says that scan was done because some abnormality was seen, then you will say that any other investigations were done. She will say no or yes. Then if she needs any further investigations, you will recommend them. So if the scan was done in fetal medicine department, then you will have to explain the details and confirmations, and then you will have to look for any other abnormalities if the baby has. Then you should explain the findings of fetal echocardiography. And then if any karyotyping was done, then you should explain that what procedure is required. Do we need to do amniocentesis, cardiocentesis? And then also explain that what is the background risk of miscarriage and what is the procedure related risk. Because you have to make you will have to give the patient chance to make an informed choice. So you are going to tell them about the benefits and the risks of any procedure, and you will not influence her decision making. As a doctor who is taking OSCE, your job is to help your patient in reaching some conclusion. So let her make her own choice, and you are going to respect her wishes, and you are going to mention everything in her notes. Now the baby has been diagnosed with many abnormalities which are not compatible with life. Let's say that this baby is anencephalic. Then you will give her different options. Like in such cases, there is an option of termination of pregnancy. So according to the period of gestation, you will have to explain everything to her. You will have to refer the patient to the fetal medicine or the higher center. Then you should tell her that we need to make a multidisciplinary team. Usually in the team, you will include one neonatologist, one pediatrician, and surgeon, and sometimes some genetist. They also have to be involved. Then if you are planning some preterm delivery, like the baby has some abnormality which is compatible with life, or the parents, they don't want to go for termination, then you will have to deliver prematurely. In that case, you will have to give antenatal steroids. If the parents they can decide to continue this pregnancy, then you will have to offer routine care. At the same time, you have to make a plan for delivery, mode of delivery, timing, place, and you should always remember that you will carry out cesarean section only because of obstetric indications. Neonatologist team should be available for delivery. In some situations, when the baby have other abnormalities and which can be managed later, then you have to arrange an ICU bed. This is your responsibility. If you need to transfer to another facility, still it is your job to call the next hospital, talk to the consultant, and arrange transfer and bed for this person, for this patient. Then you have to tell them that what else can occur, what else they should expect. Then you should invite questions. You should address patients' concerns, questions, and you should comment on all organs of the baby, that how are the kidneys, how are the lungs, how is the gut, and everything is working properly or not. How is the placenta? And then what is the possible cause of these abnormalities? And can one abnormality influence development of another abnormality or not? Then you need to tell them, is there anything that we didn't talk about in the discussion? Do you want to ask about something else? If you will ask something, you have to explain. If she will ask you what is the incidence of this problem, then you don't have to say that what is the percentage. You will have to tell her that if we have 100 women of your age, then maybe 10 out of them they can have such problems. So this information should be evidence-based. Then very important for you to close the station. You should arrange further appointments. You should discuss again with the partner, husband, family. Then give her patient information leaflet, and then again you should tell her who is responsible for her care, how she can approach the team, give her an emergency contact number, and then you will say thank you very much for coming and talking to me. That's how you're going to close the station. It's very important to initiate it appropriately, and then even more important to close it appropriately.